Hello, my name is Dr. Steve Hargarten. I'm honored to be able to present on this panel on firearm violence in the Western Hemisphere. Where do we stand in 2026? I'm honored to be able to make some comments. I am disappointed that I'm not able to attend the conference in person, and I would like to present the answers to the four questions that I was asked to answer. Before I do it, I'd like to at least set the stage for some of this activity. First of all, where do we stand? Globally, there were over 250,000 firearm deaths annually in the world. Six countries account for just over half of these deaths: Mexico, Brazil, Colombia, Venezuela, Guatemala, and the United States. These countries in the Americas. And with the entire Western Hemisphere, including the Caribbean, it accounts for close to 70% of all these deaths. The leading cause of death for children and adolescents in four countries in the Americas is a bullet, not a virus. Mexico, Colombia, Brazil, and the United States. Hundreds of thousands of persons are injured each year, many with lifelong disabilities. Communities are disrupted, forced migration ensues. We need comprehensive policies and programs to strengthen trauma care systems, invest in trauma care systems, and include psychosocial care of these patients with coordinated secondary and tertiary prevention, just like we do with other diseases plaguing the Americas. Comprehensive strategies for malaria need to go through all four of these areas. We want to attack the agent of the disease, in this case, virus, one of the four parasites that cause malaria. We want to attack the vectors, mosquitoes. We want to attack the environments, lower the risk of stagnant water, which breeds mosquitoes. And we want to lower the risk of high-risk groups like children who at night are sleeping and need to have netting that protects them from mosquitoes. Just like malaria, we need to do the same with firearm violence. We want to address the agent of the disease, in this case, the bullet and its kinetic energy that tears and destroys organs and tissue. We want to address the vector that carries these bullets, handguns, rifles. We want to address high-risk environments, schools, churches, parks, homes, streets. And we want to address and look at high-risk groups such as children and adolescents. Just like we do with malaria, we want to attack all four sectors equally with strong policy, prevention, research efforts that reduce firearm-related harm. So gun violence in 2026, are we winning or losing? The city of Medellin in Colombia has won. Their homicide rate is drastically decreased. In Baltimore, Maryland, United States, homicide, firearm-related harm has decreased significantly. However, countries like Ecuador are losing the battle with firearm-related homicides and are having a significant growing problem. Jamaica is struggling with what to do, how to do, and address firearm-related harm. So there's a variety of countries, cities that are winning. There are countries that are actively losing, and there are countries that are struggling, such as Jamaica, and they have convened a Caribbean plan that is comprehensive in its nature and scope, and hopefully countries like Jamaica and others will begin to strive towards reducing firearm-related harm. So what is the main drive of gun violence today? Guns, gangs, drugs, or inequality? All of it. Guns and bullets in the Americas, primarily coming from the United States. Ample evidence demonstrates this, both with firearms and the bullets they carry. And we need to address that movement of the vector and pathogen from the United States into Mexico through the border, or from dealers in Florida and Georgia going to Jamaica, for instance. But then gangs, once they are buying, they can buy illicitly traded firearms with the monies that they generate with drugs, and they want to then continue their extortion, intimidation, and instigate violence and disrupt communities in order to gain their foothold in the drugs and the money that they are desiring. The inequalities result in communities and families affected. Youth with limited opportunities are adversely affected and need to have better programs. Forced migration occurs. Poor sections of communities are adversely affected. So the main drivers are all of these, but we need to look at it just like we do with another public health problem, such as malaria, dengue fever, looking at all elements of what is influencing firearm-related harm. And with a really interesting case study back in 2015 where the Zika virus emerged in Brazil. There was a huge, significant interest on the part of the United States to address the threat of mosquito coming north into the United States. Millions of dollars were allocated to address this emerging epidemic. And yet, during the same time, and continues today, firearms manufactured in the United States find their way through Mexico, Central America, into South America and beyond. And we need to address this in a public health framework, just like we do with mosquitoes. Why are some countries reducing firearm deaths while others are worsening? And the summary statement, which we don't have time to go into, but when governments and civil society act in unison, that they are aligned, gun deaths go down. And there's ample evidence of that happening across the globe. So can trauma systems alone change outcomes, or must prevention lead the fight? Trauma systems are critically important to strengthen secondary and tertiary prevention. Prevent deaths when a person is injured by a bullet. Prevent and reduce disability from the injury once it has occurred. We need to strengthen trauma systems to be able to do that. But trauma systems can and must inform primary prevention with quality data that measures the cost, identifies high-risk groups and environments, and informs health ministries. And so all sectors of civil society must be aligned. And in this case, the trauma systems and the providers of those trauma systems need to be aligned. Trauma surgeons, emergency physicians, nurses, anesthesiologists, social workers, psychologists, and others that are the team that informs all three prevention strategies. So what can we do together? I would ask you to consider joining, and your organization joining the Global Coalition for WHO Action on Firearm Violence. It's a critical opportunity for us to gain member state interest in advancing a World Health Assembly resolution calling for WHO action on firearm violence. And we've had interest in organizations from Brazil, Mexico, Panama as examples where member states are considering advancing this not only with WHO, but also with PAHO. And PAHO is a very, very important member, a member of WHO, but an independent organization that has been in existence longer than WHO. Here's our final call for your consideration of joining the coalition. Our QR code is below, and we have over 120 organizations, over 40 countries represented, calling for WHO action. We want to have also calling on WHO and PAHO to integrate firearm violence into prevention, trauma care, rehabilitation, mental health, and so forth. We are asking you to engage in your respective health ministries upon your return to your countries that get active interest in advancing a WHO resolution on firearm violence prevention and care. And civil society and professional organizations like the Pan American Trauma Society are key members of this professional associations and need to be engaged in this in a constructive way. So I thank you very much for listening to my brief remarks. Here's the Spanish version for your consideration, and the slides will be available upon request. Thank you so much, and please don't hesitate to follow up with any questions you may have in my email below. Thanks very much.